This is Joe Minardi from West Virginia University, and here I'm presenting our e-poster for the American Institute of Ultrasound and Medicine Scientific Assembly for 2020. The title of our e-poster is MitraClips Associated Endocarditis, an emergency department diagnosis with point-of-care ultrasound. Here's our original title slide. I'd like to thank our co-authors, Elizabeth Rempfer, Hayden Basinger, Dr. Lauren Stowovi, Dr. Bradley End, and Dr. William Shocker. Background: if you're not familiar with it, the MitraClip device is an endovascular device for repair of mitral regurgitation in patients who are at high surgical risk. Like other cardiac devices, infectious endocarditis is a known complication. If you're not familiar with it, we'd like to review the sonographic appearance of the device and also point out that it's going to be increasingly important for emergency physicians to recognize when they treat patients who are symptomatic. Our case is unique in one, that it was diagnosed immediately at the bedside. It was associated with Corynebacterium, which is atypical for infectious endocarditis, and to our knowledge, this is the first case recognized initially with point-of-care ultrasound. The report: this was an 80-year-old male who presented with vague symptoms, falls, generalized weakness, multiple comorbid conditions, who had MitraClips implanted about 4 years prior. Several years prior to that, the patient had been treated for pacemaker-associated endocarditis and had to have the implantable cardioverter defibrillator removed. The patient did admit on questioning to feeling short of breath and having decreased oral intake due to dental pain, and that was resulting in a 29-pound weight loss. The patient did appear chronically ill and had diminished left-sided breath sounds and pitting edema of the lower extremities. Due to the patient's shortness of breath, point-of-care ultrasound of the heart and lungs was performed, and this showed a significant left pleural effusion and other findings of pneumonia. Also noted was mitral valve hardware, which wasn't clearly known at the time, but this was associated with a highly mobile vegetation, and infectious endocarditis was suspected. Multiple blood cultures were drawn, broad-spectrum antimicrobials were initiated, and the patient was admitted with cardiology and infectious disease consults. So prior to this, there have been about 6 cases of infectious endocarditis reported in patients with the MitraClip device. This is the first report identified in the emergency department with point-of-care ultrasound, and also, to our knowledge, the first report where it was associated with Corynebacterium. As reminders, a transthoracic echo cannot rule out endocarditis, but since it's relatively easy, safe, and low cost, it is still a first-line imaging test. Sensitivity is 46 to 60%, but the specificity is pretty high. And while a point-of-care ultrasound examination is not a substitute for a comprehensive transthoracic echo, POCUS may confirm the diagnosis and allow rapid initiation of therapy, and then decisions on disposition, maybe even transferring the patient depending on the setting where they're initially seen. So just to show a couple of the views, this is one of the subcostal views, where here you can see this mass on live footage. It's very mobile, and it's associated with the MitraClip device, which we'll point out here. Here we can see the dense parallel bars of the MitraClip device itself and this dense acoustic shadow. So that's the typical appearance of the MitraClip device. In this apical 4-chamber view, this is the mass, a little more difficult to visualize in this still image. So let's go ahead and move to the clip. Here's the subcostal view showing the vegetation in real time. You can see it's highly mobile, moving back and forth, associated with the dense parallel bars of the MitraClip device itself. So conclusions: while we know prosthetic valves and other hardware can be associated with endocarditis, there are not many reports of endocarditis associated with the MitraClip device, and this is the first identified by point-of-care ultrasound in the emergency department. The MitraClip device is going to be an increasingly common intervention for mitral regurgitation in these poor surgical candidates, and so emergency physicians like ourselves need to have a low threshold for evaluation in these patients. Point-of-care ultrasound is low cost, it's rapid, and it can help us find these things quickly, and we should be familiar with what they look like to help us recognize the abnormalities and make decisions regarding treatment and disposition, which hopefully should improve outcomes. Again, thank you. Here are some of our Twitter handles, the ones of us that have those, and thank you very much.